Hello, dear parents. In today's video, we'll cover a common and very concerning topic for many families: when a baby's fever won't go down. Your baby feels warm to the touch, cheeks are flushed, and the thermometer reads over 100.4 degrees Fahrenheit. But hours pass and the fever won't drop. Why does this happen? When is it dangerous? What steps should you take? Let's break it down together, step by step. Fever is the body's natural response to fighting off infections. In babies, a rectal temperature over 100.4 degrees Fahrenheit, 38 degrees Celsius, is considered a fever. A fever between 101.3 degrees Fahrenheit and 102.2 degrees Fahrenheit is considered moderate. Above 102.2 degrees Fahrenheit, 39 degrees Celsius, is considered high. Since babies' immune systems are still developing, fever is often one of the first signs that something is wrong, so why won't the fever go down? There are many possible causes for persistent fever. First, viral infections. Viruses like the flu, RSV, or adenovirus can cause fevers that last several days. Fever is the body's way of fighting the virus. Second, bacterial infections. Middle ear infections, pneumonia, and urinary tract infections can also cause stubborn fevers and often require antibiotic treatment. Third, post-vaccination reactions. Some babies experience mild fever for 24 to 48 hours after getting vaccinated. This is normal unless the fever rises above 102.2 degrees Fahrenheit, in which case you should contact your pediatrician. Fourth, overdressing or a hot environment. If a baby is wearing too many layers or is in a very warm room, their body temperature can rise, even without an infection. Fifth, teething, a debated cause. Some babies may run a slight fever while teething, but temperatures above 101.3 degrees Fahrenheit usually indicate another underlying issue. Now, how do you know when a fever is dangerous? The fever itself is important, but the symptoms that come with it matter even more. Call your pediatrician or go to the hospital immediately if your baby is under 3 months old and has a fever above 100.4 degrees Fahrenheit. They are having trouble breathing, wheezing, or appear pale. They are vomiting frequently or refusing to eat. They are very lethargic, unresponsive, or floppy. You see rash, bluish skin, or uncontrollable shivering. The fever lasts more than 72 hours. Fever reducers don't help, and the temperature remains high. What can you do at home before seeing a doctor? Here are safe, doctor-approved home interventions. 1. Lukewarm compresses. Gently place lukewarm, damp cloths on your baby's forehead, underarms, or groin. Avoid using cold water or ice. It can cause chills and worsen the situation. 2. Fever reducers. Use acetaminophen or ibuprofen in the correct dosage, only if your doctor has approved it for your baby's age. Never use aspirin in children. It can cause serious complications. 3. Light clothing and ventilation. Avoid overdressing. Keep the room temperature between 69 to 73 degrees Fahrenheit, 21 to 23 degrees Celsius. Ensure good air circulation. 4. Hydration fevers increase fluid loss. Breastfed babies should nurse more often, and formula-fed babies should be offered frequent small feeds. How to monitor the fever properly? Use a digital thermometer, ideally rectal for infants. Record each temperature in a notebook, along with medication times and doses. Note when the fever rises or drops. This helps your doctor understand the pattern. When should you go to the ER? Go immediately if your baby's fever hits 104 degrees Fahrenheit, 40 degrees Celsius, or higher, if they have a seizure, eye rolling, stiff limbs, unconsciousness, if they refuse to be held and cry nonstop, if they completely stop feeding, if they've had very little or no wet diapers for a long time. Let's answer a few common questions. I gave medicine, but the fever didn't drop. What now? Check if the dosage and timing were correct. Also ensure your baby is staying hydrated. Call your doctor. Is bathing okay during a fever? A lukewarm bath is fine, but if your baby starts shivering, stop immediately. Is fever always dangerous? Fever is a sign that the immune system is fighting back, but uncontrolled high fevers can be dangerous and must be monitored. Remember, dear parents, fever is not a disease, it's a symptom. What matters most is identifying the cause, tracking it carefully, and seeking medical help when necessary. If you found this video helpful, please like and subscribe to our channel. We'll see you again soon with more health tips. Stay well and take care.